welcome back to Great Day Louisiana special Back to School episode. All hour long, we are sharing some great information to help you as parents get ready for those kids to go back to school. One of the things to check off as we head back to school, everybody, is to get a wellness check for your kids. That includes getting the required immunizations. And guess what, everybody? There is now a new required vaccination for the state of Louisiana. So we have asked Dr. Anthony Hudson, a pediatrician with Children's Hospital New Orleans, to come to our LCMC Health Wellness Lounge to talk about this new required vaccination and so much more. Dr. Anthony, welcome.
Yeah, good morning. Thank you for having me.
Thank you so much for being here. So glad we're having this conversation. I remember going to the doctor, getting all my vaccinations, then heading to the classroom a couple of weeks later. I'm surprised, not really, but I'm intrigued by now the state of Louisiana is requiring children to get the hepatitis A vaccination. Why are they now requiring this?
So going into lower school, as you said, we're now screening for the hepatitis A vaccination for admittance into school. I'd say mostly because how it is spread, that virus is spread quickly in close quarter environments. Oftentimes with improper hand washing, it can spread quite quickly. Another example would even be the daycare setting where that virus can spread quickly. So it's not necessarily that we're seeing more cases of hepatitis A in Louisiana, but again, just to help protect our young population, and again, given how it's spread, it is now recommended prior to admittance into school.
And what age do children get this vaccination?
Hepatitis A is given around 12 to maybe 18 or even 24 months of age.
Okay, and remember everybody, like we mentioned, it is now required in the state of Louisiana. But there are other vaccinations that kids need to get every single year. Let's talk about some of those required vaccinations.
Sure, so we're already talking about our infants and toddlers, and other vaccines required is your tetanus vaccination. Most of us are familiar with that. There are a few other components to that tetanus vaccination, such as diphtheria and a type of pneumonia or whooping cough. And some other vaccines require is hepatitis B, as well as your measles, mumps, rubella vaccine, and your chickenpox or varicella.
When kids are heading to the pediatrician to get these vaccinations, do you give them all at one time? Do we come at one day and then we come next week for others? How does that work?
So the majority of vaccines are given when you're just maybe 2, 4, 12 months of age. As a 1 or a 2-year-old, logistically in our clinics, it breaks down to just 2 shots total or 2 pricks, but there are multiple vaccinations within each needle.
And everybody needs to get those vaccinations before they head to school. But as kids get older, there are other immunizations that are added to the list. Let's talk about when kids go into 6th grade. What is added?
Yeah, as they enter middle and upper school, we also vaccinate our young population against the meningococcal bacteria. And that's a series of 2 shots, as you highlighted, at age 6 or 6th grade, approximately 11 years of age, as well as the 11th grade or 16-year-old age group.
Wow. Now, why do they need 2 doses?
2 doses of the vaccine provide 10 to 20 years of resistance. It's really giving you sufficient protection for 1 to 2 decades of time, require 2 shots.
And we all know about COVID and the flu. Are those required vaccinations as well for schools?
Required would not be the appropriate term. I would recommend them, certainly, during the flu season, for example. So not really given during this time of year where we're doing a lot of wellness visits in our clinic. Flu, for example, is given in the fall season, or I just remember Halloween is the time to go and get your flu shot.
Now, let's talk about aftercare, right? Because I remember when I would get my vaccinations, even now as an adult, my arm hurts a little bit. What's the best aftercare when it comes to getting those immunizations and trying not to feel so sore, or the soreness is inevitable?
Yeah, I think you're speaking to the most typical response to a vaccination, where we can be slightly sore or maybe even red at the injection site. I would like to spin that as a positive. I do think having some muscle soreness is indicative of a response to the vaccine.
Okay.
Some of us are not always fortunate enough to respond to the vaccinations and generate immunity to them. But just in terms of general supportive care after the vaccination, I do think a medicine such as Tylenol or ibuprofen is appropriate to give.
Right after?
I would say more of if you're feeling symptoms after the administration. You can give it at the time of the administration of the vaccination. Personally, I would prefer we wait to see if you do have some of those side effects before offering that medicine. And another trick would maybe just be something as simple as a heating pad to increase the blood flow to that area where we do the vaccination.
Some great information, Doctor. Thank you so much for being here. Look, for more information about required immunizations, you can log on to chnola.org or give them a call at 504-547-7712.